classmates and Professor Parsons. This is Erin Mia Sherrill. I and my partner Martin will be presenting today on the implementation of a nurse staffing committee in long-term care. This is the PowerPoint of our leadership proposal. The objectives of this presentation will be to first discuss the problem. In this case, it would be inadequate nurse staffing in long-term care. Next, we'll identify factors influencing staffing needs. We'll discuss the cost. We'll discuss communication strategies of this leadership proposal. We'll discuss how we will be using Coder's 8-step process as the leadership theory model. And lastly, we'll introduce our decision-making model for this project. So first, the problem. In 2007, it was estimated 21,789 people in Hawaii needed long-term care. Residents of long-term care facilities are increasing not only in number, but also in acuity. Insufficient staffing results in poor patient outcomes, more rehospitalizations, poor facility ratings, and high turnover rates, which results in increased staffing costs. The criteria for needing long-term care are individuals needing 2 or more activities of daily living limitations lasting 90 days or more, or a cognitive impairment. Long-term care services may include residing in a long-term care facility or having in-home chore services. Our project was focused on long-term care facilities solely. Adequate patient care is highly dependent on an efficient healthcare delivery team. Nurses make up the largest clinical subgroup in healthcare settings. Residents of long-term care facilities are increasing not only in number, but in acuity, resulting in nurses needing to spend more time with patients. Insufficient staffing results in serious consequences, such as poor patient outcomes, more rehospitalizations, poor facility ratings, and high turnover rates, resulting in increased staffing costs. According to McConnell, Leakin, and Corazzini, over 3 million certified nursing assistants and licensed nurses are employed in long-term care facilities nationally. Of these 3 million individuals, about 2.5 million are certified nursing assistants, and the remaining 500,000 licensed nurses are evenly divided between licensed practical nurses and registered nurses. The Bureau of Labor Statistics Employment Projections 2012 to 2022 projects the need for 525,000 replacement nurses in the workforce, bringing the total number of job openings for nurses due to growth and replacements to 1.05 million by 2022.
Cost. Cost is also an insufficient staffing need variable because it considers the staffing needs, the acuity patient needs, nurse skill level, staffing modules, budget restrictions, and fiscal allocations, turnover, and time. It is estimated that $22,000 to $64,000 per nurse turnover is used. We can use that money in providing care for our patients, and the committee is being formed to advocate for a nurse to patient ratio, which can help with recruiting and training, and the money that will be used to retrain, recruit, can be spent in retention and keeping nurses satisfied in the workplace. Communication strategies. The strategies that we will use to communicate this change would be telephone calls, emails, live presentations, and also building a relationship with the key stakeholders is very relevant to implementing the change. And effective communication will actually be what we will emphasize for the overall success and effectiveness of the program. Using Cotter's 8-step model, we will be able to promote change within the facilities of long-term care, increase urgency, build correlations, give the vision, communication, enable action, quick wins, don't let up, and make it stick. overall stating that we will begin with urgency of the need and we will end with urgency of the need, making it stick, making it very relevant that change is needed, that we would benefit from having a nurse to patient ratio within a long-term care setting.
The decision-making model that we use for this project is the group decision-making model. The group decision-making model is intended to foster healthy communication, allowing the group to combine ideas in coming to a decision. With the establishment of a coalition, there are energetic leaders who can guide implementation of a decision-making model, ensuring each member of the group is included. The group decision-making model has benefits, which include accumulating more knowledge and facts, possessing a broader perspective, and being able to consider more alternative solutions. There are many ways that groups can come to a decision. For example, there is decision by authority, decision by ranking, and decision by unanimity.
References for PowerPoint. Audio references for PowerPoint. Audio references for PowerPoint.
Thank you all for listening to our presentation. If you have any questions, comments, or concerns, please feel free to email either one of us at the email listed below. Thank you.
Thank you.